Hi students, I'm going to make a review video for you for 1204 for the final exam. Bobby is also making a written review so that you can have it both ways. Hopefully both of these things will help you prepare for your final exam on Wednesday the 14th. So I want to start by reminding you that the vocational nurse's role in patient-centered care is to promote, restore, and maintain health. Vocational nurses also help coordinate care. And in the beginning module, remember we also talked about different delivery systems when there's different ways of describing how nurses are organized on a unit. And when a nurse is assigned to only perform one duty, like only give medications or only do discharges, then that's called the functional nursing care delivery method. Okay, it's functional nursing care when the nurse is assigned to do only one task during that shift. Okay, I'm just kind of reviewing my notes as I'm talking to you. The Nurse Practice Act, the primary purpose of the Nurse Practice Act is to protect the public. You will want to review some of the other roles, member roles in the healthcare team, like the psychologist, the social worker, the registered nurse, the physician. What do each of those roles do? The vocational nurse does not design the nursing care plan, but contributes to it. So the vocational nurse functions interdependently, and that means within the healthcare team and with other disciplines by offering suggestions to modify the nursing plan of care. And so that means that maybe your assessment brings up new data to give to the RN or the physician that will help modify the nursing plan of care. When you act as a patient safety advocate, I mean, you will act as a patient safety advocate in everything that you do. And when you're giving medications, what that looks like is that you're verifying the patient's identification. You're checking the date of birth and the medical record number, the name. You're verifying allergies before giving medication. That's all part of being a safety advocate. Remember that outcomes need to be very specific. We talked about care plans and how to write outcomes. And so saying something like the patient will walk 60 feet with one assist by noon on October 20th, that's very specific and measurable. And so that would be a good outcome. If you just talk about like patient will have no complaints or patient will cooperate, what does that mean exactly and how do I measure that? So you want your outcomes to be very measurable. What will the patient do? Exactly how will they do it and by what date? Remember, your SMART goals have to be specific, measurable, attainable, realistic, and time sensitive. You'll want to review the Holmes-Rahe Social Readjustment Scale, and that measures cumulative stress. And based on the score, the score will let you know how much at risk the patient will be for future health problems. So a score of 400 would indicate a really high level of stress, and that might contribute to some future health problems. You want to review Socratic questioning and what that is. So Socratic questioning is, that type of questioning where you're sort of exploring different explanations for why things are happening. So when a patient's faith does not permit blood transfusions, and the patient does acknowledge the refusal risks and asks still for the refusal form, and they're fully saying, I understand that if I don't have a blood transfusion, I could possibly die. The nurse's best approach is really to establish rapport, develop that trusting relationship, and listen as the patient shares belief. It's not about the nurse's beliefs. It's not a time to give advice. You should never be giving advice. You've already provided all the information. They have verbalized that they're aware of what they're doing and the consequences. And so the nurse's role at that point is to just be present and listen. We talked also in the spiritual and cultural module about signs of spiritual distress. And so some verbal and nonverbal behaviors that indicate spiritual distress are possibly exhibiting a disturbance in a value or belief system, um, such as, why does God doing this to me? Or, I feel like God is punishing me. Those type of statements indicate spiritual distress. When a patient is meeting with a chaplain or a religious guide of any kind, priest, rabbi, whoever is visiting the patient, it's the nurse's job to find a private space for that meeting to happen. Maybe it can happen in the patient's room. If the patient has a roommate, then try to arrange for a different space and definitely provide for privacy during that visit. Ritual baths are part of the care of the deceased body, primarily in Jewish and Muslim religions. So you want to review some of the religions presented in your textbook and what some of their beliefs and rituals are. Remember that documentation is a legal obligation, and it is considered a standard of care because, as you've heard, if it wasn't written, it wasn't done. And so actually failure to document is substandard care. You also want to review subjective and objective data. And so what the patient reports is subjective. That's coming from them, the subject. Objective is what you observe. So review those terms and be sure that you know some examples of each. You also want to review communication skills. So if someone is saying, they're really stressed out about their hospital bill, I don't know how I'm going to pay for this, and we have all these bills, and we were planning for a vacation, the nurse might say something like, you seem concerned about finances. So you're validating what the patient is saying. You're not trying to find an answer for them, although you could say, I could refer you to, the hospital finance department, and that's fine. But you do want to acknowledge and validate first what the patient is saying. So you seem concerned about finances is a good way to validate what they're saying and make sure that you're understanding them um, correctly. Please review some of the theories that you learned, like deontological and utilitarian. Remember that utilitarian focuses on the greatest good for the greatest number of people. A patient's belief system and their worth is called their value. Okay, it's not just a belief, but their belief system and the worth that they put on an idea or custom is a value for that patient. So understand what values are. Please also review ethical principles of veracity, non-maleficence, beneficence, and fidelity. You do need to know all of those ethical principles, not just for this final exam, but for mental health and mental illness in level 2. We will be coming back to these ethical principles right at the beginning of the course, so please do know them and understand how to apply them. So the nurse's belief, that the patient really has a right to all the facts about their illness is the ethical principle of veracity, which is truth telling, and it's revealing all of the details of the patient's diagnosis and all the information that you can provide to support that patient's knowledge. Remember that non-maleficence is doing no harm. Fidelity is really being loyal to your word to the patient. So if you say you're coming back in an hour to do something, you need to come back in an hour. That's fidelity. And it's also being loyal to your profession, keeping up with your continuing education, and keeping up with knowing how to do procedures in a safe and legal manner. That's all part of fidelity also. Understand effective verbal messages. So an effective verbal message should be simple, clear, and relevant. Effective verbal messages need to be simple, clear, and relevant. In the implementation phase of the nursing process, you want to go over all of the phases, the assessment phase and the implementation phase, evaluation phase. That in the implementation phase, that's when all the interventions are implemented. Implementation, implementing interventions. So look for those keywords in your test questions. You want to go over coping mechanisms, denial, rationalization, projection, and regression. And rationalization happens when patients say things like, I only do this when, or, they minimize. Take the person who's drinking. I only drink when I'm stressed. That's a rationalization for someone who clearly has a problem. So coping mechanisms, review some coping mechanisms. Repression is when you're sort of tamping something down. You don't want to remember it. You don't want to acknowledge it. And that can happen when people are sexually assaulted. Maybe they're not able to recall details because they're repressing that information. The reason why you do so much introspection in nursing, and we've done several introspective type posts and discussion post assignments, is because understanding yourself will help you have an understanding of others. You really can't help someone else until you're really helping yourself. So you have to look within first before you help someone else. What really helps people cope is their support systems. And so one of the first things that the nurse will assess when someone is in crisis is how are their support systems? Do they have a support system? And how effective is that support system? Remember that when patients are less than kind to you, remember that they're not feeling well. And so, patients, like all of us, are not at our best. They're not at their best when they're not feeling well. And so, sometimes they may say something unkind or yell or, behave in a way that you might want to take personally, but you shouldn't take it personally. It's not about you. They don't know you. You have to just let it roll off your shoulders. And, you could say, you sound angry. Tell me about that. Or, and maybe that will help guide them to what they're really angry about. So, if someone's yelling at you, again, validate how they're feeling. Be there with them and be present. Don't withdraw and think, oh my gosh, they're being so mean to me. That's just a symptom. Them yelling at you is the symptom. So you want to say, you sound angry. Let's talk about that. All right. Talking about some mental health issues from the last module. Um, so if you look at a nursing diagnosis of, if the patient has a diagnosis of like high risk for violence and they are cursing and threatening to harm others, the first thing you always want to do is talk to a patient. But if it's past that point, if someone's screaming and they're picking up a chair and they're already threatening and they're past the point of talking, clearly, you want to remove the other patients from the area. So, this is the person who is really kind of out of control, um, and they have a history of violence. At that point, you want to remove the patients from the area to be sure that everybody is safe. All right, back to some legal issues. You want to review tort and malpractice and professional liability. And when you fail to do something that a reasonable and prudent nurse would do, such as raise the side rails, put the bed in the lowest position, turn in position, if those things lead to injury or death, that is malpractice. So malpractice has to do with a failure in doing what a reasonable and prudent nurse would do. You want to review Maslow's hierarchy of needs, what order the needs go in: physiological, safety, love and belonging, self-esteem, self-actualization. It might even help you to make that little triangle on your whiteboard, so that will help you prioritize if you have questions that are asking you to prioritize. Just remember, physiological needs are first, and the lowest need has to be met before going on to the need above it. Okay. You also want to review some payment programs when it comes to healthcare programs. Medicare is one established in 1988, and Medicare does provide coverage for medications in Medicare Part D. So understand Medicare and some of the different parts and where the medications are covered, that kind of thing. If someone makes remarks about their body, I am so ugly, and I'm struggling, and they're like, saying these negative self-talk things. You want to really ask them how they're feeling about whatever came before this. So if they're in the hospital and they had an arm amputated, and so now they're saying, I'm so ugly and deformed, you might want to say, tell me how you're feeling since your amputation. Describe how you're feeling to me. Obviously, they're having some feelings about whatever surgery they just had, if it's in the hospital and related. All right, remember that vocational nurses do focused assessments. You don't do medical diagnoses and you don't prescribe. And the comprehensive assessments are done by the RN, usually on admission or daily or on a regular basis, but vocational nurses perform focused assessments, and that's per the Nurse Practice Act for the state of Texas. We are a reporting discipline. We are obligated to report cases of abuse and neglect, specifically regarding children, and you would report it to the proper legal authority, which would be, I think, Department of Children's Services. There's emergency numbers. Wherever you're working is going to have that information for you, whether it's elder abuse or child abuse or abuse of somebody in the facility. You will be provided with numbers and how to report that. And upon hiring, the Human Resources Department will give you that information. So remember that patients have a right to choose their health care and their therapy, and that is the ethical principle of autonomy. And so when a nurse struggles with the patient's decision, going back to the patient that was refusing a blood transfusion, that nurse is struggling. If you're struggling with that as a nurse, that nurse is struggling with the ethical principle of autonomy. And that's not the autonomy of the nurse, it's the autonomy of the patient. All right, again, make sure your outcomes are very specific and measurable. In nursing diagnoses, always be sure that the nursing diagnosis has 3 parts to it. It's the diagnosis related to what is causing the diagnosis as evidenced by, and that's the evidence supporting the diagnosis. If it's a risk, like risk for falls, then you don't need the evidence because it hasn't happened yet. So risk for falls related to unsteady gait. All right, they're just at risk. It hasn't happened yet. But if it's an actual diagnosis like pain related to tissue damage, as evidenced by patient states, my pain is at an 8 on a 0 to 10 scale. So make sure that you understand the parts to a nursing diagnosis and that you can recognize a nursing diagnosis written correctly versus one written incorrectly. Because you might have to identify the correctly written nursing diagnosis. So review that. Nursing students are accountable for all nursing care provided and held to the same standards as a licensed nurse. So when you are working in clinical as a student, you are held accountable for all the care that you provide. It's important for you to know. I think we talked about communication. You want to review some of the documentation lecture that we went over, and some of the different ways of documentation, the narrative form, API form, Also, what it means to be charting by exception. So when you're charting by exception, you're not charting the norms. So you're not charting normal vital signs. Those are going to go on a vital sign graphic sheet. And I'm talking about what goes in the nurse's notes. Not that it's not charted anywhere, it's just that it's not included in the notes. So when the nurse is writing notes by exception, they're not including normal vital signs. They're not including scheduled medications because that's on the MAR, right? The medication administration record. You're not including normal assessment findings, but you might include any PRN medication that you gave because that's out of the routine. That is an exception. So if somebody had pain and received Tylenol, that's something that you would want to write about in your note that's based on charting by exception. Remember your hierarchy of needs, and airway always comes first. So when a question asks which need will you assess first, what is the priority? If one of them is breathing, remember your patient always has to be breathing. If they're not breathing, nothing else matters. So always address airway and breathing first. We want all nurses to demonstrate knowledge, skill, preparation, standards of practice, responsibility, and commitment. Those are all parts of being a nurse. Again, you want to go over defense mechanisms and stress responses, and that's in the last module on mental health. Um, when a nurse is giving report, and we're all going to work on giving report when we start clinical or in clinical, when the nurse is giving report, they're really demonstrating their role as a member of the healthcare team. It's a communication. Can you communicate effectively to the doctor, to another nurse, to the physical therapist? All of those types of reports are being a member of the healthcare team. When a nurse does something outside of their scope of practice, for instance, maybe the vocational nurse administered a medication that, per their scope of practice, an anesthesia type medication. That's not something that a vocational nurse could administer, but if they did, they would be violating the Nurse Practice Act. So remember, the Nurse Practice Act establishes the standards and the scope of practice. And so if you violate your scope of practice, it's a violation of the Nurse Practice Act. You want to definitely review stress and the general adaptation syndrome. What happens when epinephrine is released during general adaptation syndrome? That's when there's your heart is beating faster. There's bronchial dilatation so that you can get more air in. Maybe your pupils dilate so that you can see more. Your hearing becomes more acute. So you want to definitely review all of those physical changes that occur during general adaptation syndrome. Going back to finances in healthcare, um, thinking about barriers to people obtaining health care, such as a homeless person. Um, what is really their barrier to to getting better health, probably their lack of access to healthcare services. Um, so, review that section on access to health services. Again, in the module that talked about Medicare, we also talked about DRGs, and that's diagnostic related groups. And what that means is that the hospital is getting paid for a diagnosis. For instance, if someone goes to the hospital for a hip replacement, the hospital is going to get a fee based on that hip replacement, and that fee is going to include the surgery of the hip replacement, and maybe 2 or 3 days hospital stay, physical therapy. It's a group that's put together for a payment. It's sort of like in a restaurant buying like the family meal. You get all these things included for one price, or the prefix meal. So that's what a diagnostic related group is. Another example is pneumonia. Pneumonia is an example of an infection that has a diagnostic related group associated to it. And so the hospital gets paid for pneumonia. They know that the average length of stay for pneumonia is maybe 3 to 5 days. And so the hospital is getting paid a fixed rate for this diagnosis. And again, this supports why nursing documentation is so important, because it has to support what's going on with the patient and justify the payment that the hospital is getting. Remember that discharge planning starts at admission. It starts right away. In your work area, when you develop an injury or illness and you believe it is related to your job, you're first going to see an occupational health nurse. So, if someone is like working in a factory and they develop a related illness to that, maybe it's a leg injury from the way they stand all day, or maybe it's a back injury from the way they move for their job. The first practitioner they're going to see is probably in their occupational health department. Health promotion has to do with teaching. That's why you all have to do a teaching project. It is the best example of health promotion. You want to review holistic health models. Really, holistic health models say that patients are the experts regarding their own health. So the patient is always the expert. All right, and talking about the Joint Commission, the 2012 National Patient Safety Goals, one of those goals was about identifying patients and residents correctly. And so that's another, it's a huge safety issue. And so that's also why we focus so much on your ability to identify your patient correctly. Please review the Joint Commission accreditation organization. That's important for you to understand what that agency is and what that accreditation is. That accreditation is optional. It's not mandatory, but it does allow facilities to get a higher rate of reimbursement. Facilities take it very seriously. It has to do with how they're rated. People don't want to go to a facility that's not Joint Commission accredited. And facilities that aren't accredited won't be reimbursed by like Medicare and Medicaid. So you want to review that stuff. There is a difference between laws and morals, and you want to review those differences. Laws often reflect the morals of a society. So, we believe that killing each other is wrong, and our laws reflect that killing someone is illegal. So, laws can reflect morals, but they're not the same thing. In your mental health module, we talked a little bit about anxiety and what is anxiety. It's that vague, uneasy feeling, and the source is unknown, versus a fear whose source is very much known. Like you could have a fear of dogs, you're afraid of dogs. But just this general anxiety is more has to do with the unknown, the what ifs, and it's a vague, uneasy feeling. Again, you want to look at coping defense mechanisms. What are they? They're ways to decrease anxiety. Basically, all coping mechanisms, all defense mechanisms, their purpose is to reduce anxiety. And when it works for a patient in the past, it'll work for them again. So if someone is afraid to have their blood drawn, or maybe they're afraid to get an MRI because they don't like closed spaces, and it's an adult, you know that an adult has probably had blood drawn in the past, and so you might ask them, what's worked for you before? And let's do that again. So instead of trying to spin your wheels, thinking about how you're going to help this patient, ask them what they've done in the past. Coping really helps manage both internal and external stressors. Let's see what else. You want to review some of the coping mechanisms like displacement, displaced anger. I'm sure you've all experienced that when you're angry about one thing, but you take it out on another. Maybe you had a bad day at work and you go home and yell at your dog because they barked one too many times. You're not really angry at the dog, you're still angry about work. Um, so, yeah, if you have a bad day and you're just yelling at everyone, that's displaced anger, that's displacement, and it is a coping mechanism. So coping mechanisms can be positive and negative. A positive coping mechanism, maybe you go for a jog, go for a walk in the park, or meditate or do yoga. Those are all really positive coping mechanisms, deep breathing. Negative coping mechanisms, maybe you drink too much, you yell at people, that type of thing. Those are all negative. You always have to validate people's feelings and sentiments um, in the context of mental health. They're real, whether they're based in fact or not. The way people feel and what they think is still very real, and so that needs to be acknowledged, even when it's not fact based. Someone who's depressed saying, I feel like everyone hates me and I'm just sad all the time. You can't just say, but that's not true. It's everyone doesn't hate you. That's not helpful. You have to acknowledge where they are. That must be a really difficult place to be. Tell me more about that. I see that you're feeling really sad today. So that's how you want to approach that. You can't just deny the way someone feels or write it off as, oh, that's not true. That's not helpful. You always want to provide care with dignity. So when you're giving medication to a patient, if the patient has dementia and you're still providing an explanation and you're still treating the patient with dignity, you're still doing all the safety measures and doing all the things with respect for human dignity. And so you're not going to skip any steps because they have dementia or whatever they have. All right. Review primary roles. Primary roles are like man or woman. Things like husband, wife, student, teacher, those are all secondary roles, but primary roles are like, those big roles that we have in society. And for us, that's pretty much man or woman. And so that leads to a lot of struggle with people who identify as non-binary. Um, uh, that could be their role also, but in our society, it's primarily man and woman. Adaptation is an ongoing process that requires a change in function, behavior, structure. That's all adaptation. When a patient is adapting to having one leg, or adapting to a brain injury, adapting to an inability to speak, that all requires a change in structure, function, behavior, everything. You want to review the Affordable Care Act that was signed in March of 2010. That's probably the most recent government health program that provides insurance options, and you do want to review the basics of what that means, of the Affordable Care Act. Let's see. You want to go over some of the assessments, like the um, Heinrich Fall assessment, the Braden skin assessment. Um, so, if you were doing your assessment and you see an area on a patient's body that's slightly red, you would immediately want to document a Braden skin assessment. That would be the prudent thing to do. So know what assessment fits, whatever your focused assessment is. Um, when we talked about different ways of caring, um, one of the nurse philosophers was Ray, um, who talked about bureaucratic caring. And so, just kind of review the different ways of caring. Bureaucratic caring, bureaucracy means organizational. So, bureaucratic caring is when the caring is influenced by the organizational structure. So, how you care in a hospital depends on how that hospital is structured. How you care in a nursing home is going to depend on how that nursing home is structured, how you provide care, how you demonstrate the act of caring to your patient. And caring in practice, you can see that when there's a connection, some mutual recognition, and really some connection between the nurse and patient. You also want to review Roach's 6 C's of caring. Um, our vocational nursing program really supports, we really highlight those C's also. So please review Roach's 6 C's of caring. And some of them are competence and commitment. So, but review them all. Be able to identify them. You also want to review Leninger and culturally competent caring. And so you want to realize your perception of care delivery and honor the patient's culture in your care delivery. So review Leninger, that's Leininger, Leninger, culturally competent care. And what does that mean? One of the modules also talked about ways of knowing, and how do you know? What is Carper's knowing? And when there's a supportive relationship and there's an engagement rather than detachment, that's a personal knowing. So review those types of knowing. specifically carpers, that's C-A-R-P-E-R, carpers, knowing. Um, in the beginning of the semester, we talked a little bit about ways that you as a nurse will take care of yourself, things that you committed to doing this semester and through nursing school and really through your career. And that's because caring for yourself is central to caring for others. Remember, I said that you have to do some introspection before you can help someone else. You have to know yourself before you can know someone else. And you have to care for yourself before you can care for others. You can't go to work as a nurse completely exhausted because you're not getting enough sleep or you're so stressed out about home life. You're going to bring that stress with you. That's not fair to your patients. You have to be healthy. You have to be healthy before you help someone else maintain their health or improve their health. Again, you want to review some of the cultural considerations. Um, just review some of the basic cultures. You all did such a great job with your culture presentations and projects. I think you'll probably get the questions on culture, but just review some of the main considerations. Who eats meat, who doesn't eat meat, who eats pork and who doesn't, and who needs their body covered. So just review some of those main things. And you know that you'll be culturally responsive when you develop some self-awareness of your own culture. So you have to really do some introspection on what your culture means to you and where you're coming from so that you know what you'll need to fill that gap when you're taking care of someone from a different culture. I hope that makes sense. Um, Going back to some communication techniques, you want to avoid saying things like don't worry. If you tell someone don't worry, that really devalues that person's perception and it really isn't effective. If someone's really worried and you look at them and say, oh, don't worry about it, does that ever really help? I mean, think about when someone has said that to you. It doesn't. It doesn't help. So you don't want to devalue how they're feeling. You can say, you sound stressed. Tell me more about what's going on, or let's talk about your concerns. Um, so, yeah, be careful not to minimize how someone's feeling or devalue. All right, those natural chemicals produced by the body that relieve pain are endorphins. So please review endorphins and what they do. Again, you'll need to know that in mental health and mental illness in the next semester. We also talked about eustress, and that's EUSTRESS, EUSTRESS, eustress. That's a helpful, normal, and essential way of being, and it reduces stress. The purpose of the evaluation phase, again, review all the phases, but the evaluation phase is really to determine the patient's progress towards meeting their outcomes. Did they meet their outcomes? Are they working towards meeting their outcomes? And more on documentation. Remember that there's not just nurses' notes, but there's flow sheets. Um, the um, the vital signs sheet that you're doing in lab that has like the little graphics where you're charting the vital signs, that's a type of flow sheet because it's gathering several days worth of data. And so you can see the flow or the trend of what the temperature is doing or what the blood pressure is doing. So flow sheets are really an easy to read record of a patient's condition. It's just that information, a flow sheet of vital signs or a flow sheet of food intake might show you their intake for an entire week. So it's just an easy to read record of what's going on with the patient. You want to also review, what is compensation and decompensation. And so, when the blood pressure goes down and the heart rate goes up, the heart is compensating. That's compensation for the decreased blood pressure. The heart's beating faster to try to raise the blood pressure. So that is a basic review of everything on the final. The final is comprehensive, and Bobby is also making a written review worksheet for you. So I hope between these two things, you do fantastic on the final and move on to your next course. It's really been a pleasure guiding you through this course. You've done the work, and please reach out to me with any questions. Thank you.